What is a common complication of a cytokine storm? A. Increased antibody production. B. Multiple organ dysfunction syndrome, MARS. C. Anemia. D. Hypercoagulation. Acute phase response. What triggers the liver to produce acute phase proteins? A. CRP. B. IL-10. C. Pro-inflammatory cytokines. D. Antibody response. Which protein is commonly measured as an inflammatory marker? A. Albumin. B. C-reactive protein, CRPC fibrinogen. D. Ferritin. During an acute phase response, which of the following decreases in production? A. Albumin. B. CRP, C. Ferritin. D. Fibrinogen. Which cytokine is responsible for inducing the acute phase response? A. IL-10. B. IL-1. C. TNF. D. IL-6. Sterile versus infectious inflammation. Systemic inflammation without infection is termed as A. Sepsis. B. Sterile inflammation. C. Autoimmune response. D. SIRS. Sepsis-like syndromes can occur without infection in patients with A. Bacterial infections. B. Trauma or burn. C. Viral infections. D. Allergies. Sterile inflammation can be caused by all the following except A. Trauma. B. Pathogen-associated molecular patterns, PAMPs. C. Burns. D. Lupus. Which of the following conditions mimics sepsis but lacks infection? A. Autoimmunity. B. Sterile inflammation. C. Allergy. D. Anaphylaxis. Answer, B. Multiple organ dysfunction syndrome, MARDS. MODS is commonly associated with which of the following conditions? A. Trauma. B. Sterile inflammation. C. Sepsis. D. All of the above. Which of the following is used as a biomarker to assess the severity of MODS? A. CRP. B. Procalcitonin. C. Fibrinogen. D. IL-10. In MODS, which organ system is most commonly affected first? A. Liver. B. Lungs. C. Kidneys. D. Cardiovascular system. Neurohumoral response in sickness syndrome. Which of the following symptoms is associated with sickness syndrome? A. Increased appetite. B. Malaise and fatigue. C. Decreased heart rate. D. Hypertension. Cytokines act on which part of the brain to induce fever and malaise? A. Hippocampus. B. Hypothalamus. C. Cerebellum. D. Frontal cortex. What is the primary cause of sickness syndrome? A. Neurotoxins. B. Pro-inflammatory cytokines. C. Antibodies. D. Histamines. Regulation of inflammation. The balance between pro-inflammatory and anti-inflammatory cytokines is essential for A. Fever control, B. Preventing excessive immune responses, C. Reducing antibody production, D. Enhancing inflammation. Which pathway is involved in shutting down inflammation? A. NF-κB, SOCS, suppressor of cytokine signaling, CTNF, D. PRR. What is the role of the SOCS pathway in inflammation? A. Amplifies pro-inflammatory cytokine production, B. Silences cytokine signaling to prevent excessive inflammation, C. Neutralizes antibodies, D. Promotes antibody production. What happens if pro-inflammatory cytokine production overwhelms anti-inflammatory mechanisms? A. The immune response remains balanced, B. Cytokine storm occurs, C. Sickness syndrome is prevented, D. Inflammation ceases. Role of corticosteroids. Which gland produces corticosteroids? A. Pituitary, B. Thyroid, C. Adrenal, D. Pancreas. What is the primary function of corticosteroids in inflammation? A. Promote cytokine release, B. Inhibit pro-inflammatory cytokine, C. Stimulate. In which condition are corticosteroids commonly used therapeutically? A. Allergy, B. Cytokine storm, C. Autoimmune diseases, D. A and B. Clinical relevance and treatment. Which of the following can neutralize pro-inflammatory cytokines in cytokine storm? A. Corticosteroids, B. Antibodies against cytokine, C. Acetylcholine inhibitors, D. PRRs. Cytokine neutralizing antibodies are useful in treating which of the following? A. Autoimmunity, B. Cytokine storms, C. Tumor growth, D. SIRS. Which drug may be used to prevent postoperative ileus by activating the cholinergic system? A. Neostigmine, B. Acetaminophen, C. Prednisone, D. Final notes. Early intervention in cytokine storms can help prevent which condition? A. MARTS, B. Anemia, C. Autoimmunity, D. Hypersensitivity. What is the ultimate goal of early intervention in sepsis-like conditions? A. Increase antibody production, B. Reduce cytokine release, C. Prevent blood clots, D. Promote fever. In managing sepsis-like conditions, which marker is commonly monitored for inflammation? A. IL-10, B. TNF, C. CRP, D. albumin. Which of the following is critical in maintaining health during an immune response? A. High antibody levels, B. Balance between pro-inflammatory and anti-inflammatory cytokines, C. Suppression of inflammation only, D. Increased cortisol production. In a cytokine storm, which therapeutic strategy could help prevent tissue damage? A. Enhance NF-κB activation, B. Use cytokine neutralizing antibodies, C. Increase TNF levels, D. block cholinergic activation.